Hi there! Combining techniques from traditional Thai massage with Western sports massage can create extraordinarily efficient forms of treatment. In this video, the internationally renowned massage teacher Ulf Pape shows you how to do this. My name is Andrea, I am your audio guide, and here we go. We position ourselves with one leg on the bench and start with an effleurage along the patient's bent leg, which is resting against our body so that we gently move it while working from our center of gravity. In the following maneuver, we position our finger pads on the calf muscles. We palpate the triceps surae, including minimal friction movements and a light acupressure. Doing so, we also affect potential tender and trigger points. Then comes an effleurage along the patient's entire backside. Moving our entire body allows us to work with long and fluid gliding strokes. The next maneuver is a typical Thai massage technique to stretch the adductor muscles. The patient's leg is bent, with the foot placed in the hollow of their other leg's knee. A light pressure on the patient's buttocks makes sure that their abdomen lies flat on the bench. We first apply several gliding strokes along the patient's back and over their arms. Then we firmly knead the lateral gluteal muscles. And then proceed to the lateral leg where our fist melts deep into the fascia of the tensor fascia latae and the iliotibial tract, down towards and over the knee. We gently move the fist over the heads of tibia and fibula. Then follows an acupressure of the iliotibial tract with rhythmically alternating pressure, again moving downwards to the knee and over the heads of tibia and fibula. We apply just medium pressure. A good indicator of sufficient but not too strong pressure is when the patient's breathing is deep and relaxed. If the patient tenses up, our pressure is too strong. For the next maneuver, we sit sideways on the bench and position the patient's leg in our lap. We use the back side of our forearm to glide over the fascia of the hamstring by melting deep into the myofascial structures with slow and fluid movements. We gradually increase the pressure with the power and dynamics of our movement coming from our entire upper body. Then we change from forearm to fist to melt even deeper into the myofascial tissue of the hamstring. The following maneuver is to stretch the quadriceps and iliopsoas muscles. We position one leg on the bench so that we can use it to hold the patient in place, and we further stabilize their lumbar region with one hand. With our other hand, we take the patient's leg at the knee and slowly lift it, that is, pull it backwards to stretch the quadriceps and iliopsoas muscles. Then we release and gently put the leg back down again. We then position ourselves at the end of the bench to perform a slight traction movement, first on the same side and then with both legs, before we continue the entire maneuver on the other side. In between, we repeatedly include short relaxing effleurages along the patient's backside. We can, of course, combine this sequence with further and other maneuvers. I hope you liked this short tutorial. If so, please subscribe to Ulf's channel. There you can find many other tutorials offering a wide range of innovative forms of treatment in different languages. Thanks for watching and enjoy practicing.